Welcome back to Daytime Ottawa. We are talking IBS. It is one of those topics that not a lot of people want to talk about, but it's important to talk about. I'm talking about irritable bowel syndrome, and here to tell us more, I'm joined by Dr. Louis Liu. He is the chief of the Division of Gastroenterology and Hematology at the University Health Network. Welcome to the show, Dr. Liu. And let's first of all have you describe what exactly is IBS.
Thank you for having me today. And just to clarify, I'm the division head of the gastroenterology and hepatology, not hematology, but it sounds very similar.
Gotcha.
So irritable bowel syndrome is a chronic condition that affects the bowel, with bowel symptoms predominantly characterized by abdominal pain as well as associated with bowel function, like moving the bowel or changing the consistency or frequency of the bowel movement.
Are there different forms of it, Dr. Liu?
Yeah, so irritable bowel syndromes are classified into constipation predominant, diarrhea predominant, a mixed subtype, meaning patient alternating between constipation and diarrhea, or undefined. So it's predominantly looking at what is the predominant symptoms, the bowel function, and that is being subclassified based on the bowel, whether it's constipation or diarrhea or mix.
How common is it here in Canada? How many Canadians are affected?
It affects approximately 1 in 6 Canadians. If we look at the 2022 estimated population of Canada is about 38 million. So approximately 6.4 million of Canadians are currently suffering from irritable bowel syndrome.
It obviously has a great effect on people's lives and their lifestyles, Dr. Liu. Maybe you can tell us a little bit, what are some of the challenges people have living with IBS?
So as you highlight that IBS is a chronic condition, what you're showing is the constipation predominant. IBS predominantly affect working class between age 20 and 65 years of age. That consists of 80% of the populations who have IBS. Therefore, that it affects the daily quality of life as well as the productivity. About 1 in 8 patients who have IBS will be admitted to the hospital in 1 year, and that many of those are also not satisfied with the current medications. Around at least half of the patients would not be happy with what they are receiving, and about at least 1/3 of the patient cannot tolerate the medication because of the side effect.
We're going to talk about one specific medication today. It's an oral prescription. Tell us about that. This is obviously a relatively new treatment.
Yeah, so for constipation predominant irritable bowel syndrome, we have a number of prescribed oral medications. There is a new one that's just being approved by Health Canada and is now commercially available. The medication is called plecanatide or Trulance.
Okay.
It is a once-a-day dosing that in clinical trial have demonstrated that it simultaneously improves both abdominal symptom, in this case abdominal pain, as well as normalizations of bowel movement.
For those that have less severe, because as you described earlier, there are different sort of levels of irritable bowel syndrome. I mean, it's very individual, but for those with less severe, can you treat it without medication?
Yeah, so the milder form is about education, understanding what triggered the symptom, avoiding the food that are precipitating those symptoms. So we talk about lifestyle and dietary modifications. Thereafter, we can talk about normalization of the bowel movement, and there are different non-prescribed medication over-the-counter that help to normalize the bowel movement frequency and consistency. Unfortunately, many of those over-the-counter medications do not address the abdominal pain component. For patients who have significant or abdominal pain or the quality of life is impacted by the severity of the abdominal symptom, many of these patients will require go on prescribed medications.
Dr. Liu, really appreciate you spending time with us today. It's one of those topics, as I said, that not a lot of people want to talk about, but certainly an important one, especially as you described so many Canadians living with IBS. Thanks so much for joining us, Dr. Liu, and thank you at home for joining us. We'll see you next time.